Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be moving on to the last part since I had already mentioned this when I started this particular topic. So this is a huge topic, a vast topic, so I needed at least 3 lectures or videos for this particular topic. So uh, this is the last part of this topic, so pardon me. I know it was a huge topic and a lengthy or rather a tedious or a boring topic, but I can't help it. So anyways, so this lecture or this video is the last part or last video of this particular topic. So as we can see, the topic is symptoms, signs and abnormal clinical and laboratory findings not elsewhere classified. So the codes are running from R00 to R99. So let's see. I think till R65 or rather R69 I have already discussed in the previous video. That was the second part of this particular topic. So before starting with this topic, again I would like to say or mention the same thing again, that since this is the third part, so before this, 2 videos or 2 lectures are already there of this particular topic, so they are already been uploaded on our channel. So if you have not yet watched those 2 videos, then please go back and first watch the first and the second part of this particular modular topic and then come back to this part, because since this is the last part, if you begin with this part you will not be able to understand and keep track. Okay, so first watch the first video and then the second part and then come to this third part. Okay, so in this third part or last part we will be starting with the codes. As we can see, they are running from R70 to R79 and they are corresponding to abnormal findings on examination of blood without diagnosis. So these are the different codes as we can see over here. So they are following the chronological manner. Only one exception is there, so I will just highlight it. R71 ke baad we are directly having R73, so there is no R72. Okay, so the first code is R70, which corresponds to elevated erythrocyte sedimentation rate and abnormality of plasma viscosity. Then we have R71, which corresponds to abnormality of RBCs. Then we have R73, which corresponds to elevated blood glucose level. Then we have R74, which corresponds to abnormal serum enzyme levels. Then we have R75, which corresponds to inconclusive laboratory evidence of human immunodeficiency virus, that is HIV. Then we have R76, which corresponds to other abnormal immunological findings in serum. Then we have R77, which corresponds to other abnormalities of plasma proteins. Then we have R78, which corresponds to findings of drugs and other substances not formally found in blood. Then we have R79, which corresponds to other abnormal findings of blood chemistry. So first let's focus on the subcode or rather the code R70, which corresponds to elevated erythrocyte sedimentation rate, that is ESR, and abnormality of plasma viscosity. So first we will be talking about elevated ESR, that is elevated erythrocyte sedimentation rate. So it is a non-specific marker. So erythrocyte sedimentation rate or ESR rate is it's a very common type of a blood test which is done in many cases, particularly when the patient is showing some some common or some generalized symptoms like inflammation or typical symptoms of infection like cough and cold, high fever. So these are the conditions where if you go for a test for ESR, always your ESR will be elevated. So basically it's an indication of some kind of infection or inflammation in your body. Okay, it can be a mild infection also, it can be a severe infection also. So it's basically a non-specific marker of inflammation in the body. It measures how quickly RBCs settle at the bottom of a test tube over an hour. A high ESR can indicate the presence of conditions such as infections, autoimmune diseases, or cancers. However, an elevated ESR alone cannot diagnose a specific disease, as many factors including age and anemia can also influence it. Because anemia is again something which is very much common in India, particularly among the Indian women. It is one of the major health issues that Indian women face because of malnourishment, particularly during the growing up years of their life, during the adolescence period, during the puberty age. Most of the young Indian girls, it's very unfortunate that we have to say this standing in 2024, but it is a fact, it is a truth, like it is a rather it is a bitter truth that we have to accept, that still standing in 2024, majority of our young girls of India, they suffer from iron deficiency anemia, and in many cases they also suffer from hemolytic anemia. So that the major reason behind that is that they do not get the sufficient iron that they need through their food, through their nutrition. Okay, So that these are some of the factors which can also affect ESR. Okay, so it's not something that is specific. Further tests are often needed to determine the underlying cause of the inflammation. Okay. Moving on to the next important condition that comes under this particular subcode, that is R70. So it stands for abnormal plasma viscosity. So it refers to a change in the thickness or stickiness of blood which can affect its flow through the vessels. Elevated plasma viscosity is often associated with conditions like infections, inflammatory diseases, or certain cancers, particularly those involving abnormal protein production, such as multiple myeloma. Increased viscosity can lead to symptoms like fatigue, headaches, or visual disturbances due to impaired blood circulation. Low plasma viscosity, though less common, can occur in cases of severe anemia or low protein levels. Like the ESR, plasma viscosity is a non-specific marker requiring further tests to determine the underlying cause. So whether it's a elevated ESR or it's abnormal plasma viscosity, both of them are non-specific. Okay, they are not something through which, but determining which we can confirm that okay, this is the condition. Okay, we need to go for other tests and other confirmatory diagnosis. Okay, now moving on to the next important subcode, as we can see over here, it is R71, which corresponds to abnormality of RBCs. So this can occur in various forms affecting their size, shape, or function. Conditions like anemia can lead to smaller, that is microcytic, or larger, that is macrocytic RBCs, while diseases such as sickle cell anemia can cause them to take on a sickle-like shape. So that is the main feature of sickle cell anemia, and that is where the disease gets its name from. So basically the RBCs, they are biconcave shaped, okay, the original or the normal shape of RBCs. But what happens in patients who suffer from sickle cell anemia is that the RBCs, instead of biconcave shape, they become sickle shape, okay, like now jaisa, half moon jaisa ho jata hai, and as a result of which they get blocked while flowing through the blood vessels. So they cannot flow smoothly through the blood vessels, they get blocked or obstructed, which automatically leads to decreased hemoglobin and hence anemia. Okay. So abnormal RBCs may impair oxygen transport, leading to symptoms like fatigue, weakness, and shortness of breath. Hemolytic disorders can cause the premature destruction of RBCs, which is basically hemolysis, resulting in jaundice and an increased workload for the spleen, because spleen is the graveyard of the RBCs. Identifying specific RBC abnormalities often involves blood tests and microscopic examination to determine the cause and guide treatment. Okay, moving on to the next important subcode that we need to talk about, that is R73, which corresponds to elevated blood glucose level. So under this, first we need to talk about abnormal glucose. So abnormal glucose मतलब टू टाइप्स का हो सकता है, एक तो बहुत ज्यादा होगा तो उसको भी हम एबनॉर्मल बोलेंगे, या फिर बहुत कम होगा तो उसको भी हम एबनॉर्मली बोलेंगे, isn't it? So if it's very high, then it will be known as hyperglycemia, and if it's very low, then it will be known as hypoglycemia. And this can indicate metabolic disorders like diabetes. High blood sugar over time can lead to complications such as heart disease, kidney damage, and nerve problems. Over time means if it's not managed, if it's not treated, if it is not under control, if it is untreated as well as uncontrolled, then it will eventually lead to all this, further complications. And if it's low blood glucose, then it can cause symptoms like confusion, dizziness, and in severe cases loss of consciousness. I would say that low blood glucose, that is hypoglycemia, is much more harmful, or it can be much more fatal than hyperglycemia, because in hyperglycemia the severeness or the fatality, it takes a significant amount of time to reach that stage. But if a person is suffering from hypoglycemia, then very quickly the condition of that person deteriorates. Okay, if immediate medical attention is not given to that person, then that person will die. Surely that person will die. So I would say that hypoglycemia is much more fatal than hyperglycemia. Okay. Next condition that we need to talk about is impaired fasting glucose. So it's also abbreviated as IFG. It refers to elevated blood sugar levels after an overnight fast, which are higher than normal but not high enough to be classified as diabetes. Means obviously your blood sugar level is high, but there's a particular classification that we need to follow for to to diagnose, or rather to signify that whether the patient is actually suffering from diabetes mellitus or not. So when we are talking about impaired fasting glucose, it means the level is high but not as much high where we can say that the person is diabetic. Okay. It is considered as a pre-diabetic condition and indicates an increased risk of developing type 2 diabetes and cardiovascular diseases. Lifestyle changes such as improved diet, increased physical activity, and weight management can help prevent the progression from IFG to diabetes. Okay. Next important condition under this will be impaired glucose tolerance oral. Okay, so it's again abbreviated as IGT. It occurs when blood sugar levels are higher than normal after consuming a glucose rich drink during an oral glucose tolerance test, but not high enough to be classified as diabetes. It is a sign of pre-diabetes and indicates a higher risk of developing type 2 diabetes and heart disease. Early intervention through lifestyle changes, including diet and exercise, can help prevent the progression from IGT to full-blown diabetes. Next, what we have is pre-diabetes. So again, it is a condition in which blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. It serves as a warning sign indicating an increased risk of developing diabetes and related health issues like heart disease and stroke. Early interventions such as lifestyle changes in diet, physical activity, and weight management can significantly reduce the likelihood of progression to diabetes. Okay, moving on to the next important subcode, that is R74, which corresponds to abnormal serum enzyme levels. So they often indicate damage or stress to specific organs or tissues in the body. Elevated liver enzymes like ALT and AST can signal liver inflammation or damage due to conditions like hepatitis or fatty liver disease. High levels of cardiac enzymes like troponin can suggest heart muscle damage, commonly associated with a heart attack. Elevated pancreatic enzymes such as amylase or lipase may indicate pancreatitis or other pancreatic disorders. Monitoring serum enzyme levels helps in diagnosing and assessing the severity of various diseases, guiding treatment decisions. Okay, next important subcode is R75, which corresponds to inconclusive laboratory evidence of HIV. So it means that the test results are neither confirming nor they are ruling out the presence of the virus. Inconclusive means where we cannot come to a conclusion, where we cannot come to an interpretation कि okay इसको ये हुआ है या फिर इसको ये नहीं हुआ है. ये means here we are talking about HIV or AIDS. So when the test results are as such that we cannot confirm also the diagnosis, or we cannot also rule out. We cannot say also that the patient is negative for AIDS. Okay. So this can happen during the early stages of infection when viral markers like antibodies or antigens are not yet detectable. So basically what happens is, I think this is something I have again mentioned earlier also in one of the previous sessions of this module of, topic course of medical coding only, that AIDS is such a disease where for the initial around 5 to 10 years, the virus is in a latent phase. Okay, so it's known as the latent period of infection or latent phase of infection. So what happens in this particular period of time is that the viral load is less. Okay, so the number of virus that are multiplying is not that much that they can cause the symptoms or they can cause the different manifestations of the disease, but still they are present inside our body, they are replicating and they are multiplying, maybe at a slow rate, but they are doing it, they are active. Okay, so that is the latent phase, and during this latent phase or during this latent period, if the patient comes for diagnosis, or if the patient comes for testing whether he or she is positive for HIV, positive for AIDS or not, then in many cases the test is inconclusive because the viral load is not that much that it can be detected in our blood or serum. Okay. A false positive or negative result due to technical issues or test sensitivity may also cause inconclusive findings. Additional testing such as repeating the HIV test after a few weeks or using more sensitive methods like nucleic acid testing, which is also known as NAT, is necessary to clarify the results. Prompt follow-up testing is crucial to accurately determine HIV status and guide further care. Okay, moving on to the next important set of subcodes. As we can see over here, they are running from R80 to R82 and they are corresponding to abnormal findings on examination of urine without diagnosis. Okay, so first we will talk about proteinuria and then we will talk about glycosuria. Okay, so let's first talk about proteinuria. Now see, whenever a word is ending with the letters urea, it means it's referring to the level in urine. Okay, and obviously protein means protein. So proteinuria means level of protein in the urine, or rather excess of protein in the urine, because ideally the amount of protein in urine should actually be negligible, not that much, very less. Okay, so proteinuria means it's basically referring to higher levels of protein in urine, which is not normal, which is more than normal. Okay, so it is the presence of excess protein in the urine which can indicate underlying kidney dysfunction or other health issues. It is often detected during routine analysis and may be a sign of conditions such as diabetic nephropathy, glomerulonephritis, or hypertension. The amount of protein in the urine can vary, with significant proteinuria potentially leading to symptoms like swelling in the legs, ankles, or around the eyes. While transient proteinuria can occur due to factors like dehydration or intense physical activity, persistent proteinuria usually requires further investigation. Early detection and management of the underlying causes of proteinuria are essential to prevent long-term kidney damage and related complications. Okay, and the next condition that we need to talk about is glycosuria. So it is the presence of glucose in urine, typically indicating that blood sugar levels are elevated beyond the kidney's reabsorption capacity. So basically it's the same like proteinuria only. उसमें proteinuria में we are referring to abnormal levels of protein in urine, and here we are referring to abnormal levels of glucose in urine. Okay, and glucose is actually supposed to be present in much lesser amount than protein in urine in normal conditions also. Okay, so glycosuria is also like equally alarming, or rather much more alarming than proteinuria. Okay, this condition is often associated with uncontrolled diabetes mellitus, where high blood glucose levels lead to excess glucose spilling into the urine. Glycosuria, it also happens in diabetes insipidus, or rather it's the condition of diabetes insipidus. Glycosuria can also occur in other situations such as during pregnancy or in rare kidney disorders that affect glucose reabsorption. Symptoms will include increased urination and thirst as the body attempts to eliminate excess glucose. Identifying glycosuria is crucial as it can signal the need for further evaluation and management of underlying glucose metabolism disorders. Okay, moving on to the next important subcode. As we can see over here, they are running from R83 to R89, and they are corresponding to abnormal findings on examination of other body fluids, substances and tissues without diagnosis. So under this, the first condition that we need to talk about is abnormal findings in cerebrospinal fluid, that is CSF. It is a very important fluid that is present inside our brain and spinal cord, and it corresponds to the subcode R83. So these can indicate a variety of neurological conditions and diseases. Elevated WBC count in CSF may suggest infections like meningitis or inflammatory conditions such as multiple sclerosis. The presence of abnormal proteins such as elevated levels of immunoglobulins can indicate demyelinating diseases or other CNS disorders. Additionally, the appearance of CSF may be altered, such as being cloudy or bloody, which can signal bleeding or infection in the CNS. Analyzing CSF composition is crucial for diagnosing conditions and guiding appropriate treatment plans. Okay, the next important subcode is R84, and it corresponds to the condition abnormal findings in specimens from respiratory organs and thorax. So this can provide critical insights into various pulmonary conditions. For example, the presence of abnormal cells or pathogens in sputum specimens may indicate infections like pneumonia or tuberculosis. Elevated levels of inflammatory markers in pleural fluid can signal conditions like pleuritis or malignancy. Additionally, imaging studies like chest X-ray or CT scan may reveal abnormalities like lung nodules, consolidations, or pleural effusions that warrant further investigation. Analyzing these specimens help in diagnosing respiratory diseases and determining the most effective treatment strategy. Okay, moving on to the next important subcode. As you can see over here, it's R85, which corresponds to abnormal findings in specimens from digestive organs and abdominal cavity. So this can reveal a range of gastrointestinal disorders. For instance, the presence of blood in stool samples may indicate gastrointestinal bleeding due to conditions such as ulcer, hemorrhoids, or colorectal cancer. Elevated liver enzymes in blood tests can suggest liver dysfunction or diseases like hepatitis or fatty liver, or even liver cirrhosis or liver cancer. Additionally, abnormal findings in abdominal imaging such as tumors or fluid accumulation can signal conditions like pancreatitis or ascites. Analyzing these specimens is essential for diagnosing digestive disorders and guiding appropriate therapeutic interventions. Okay, next important subcode is R86, which corresponds to abnormal findings in specimens from male genital organs. So these will indicate a variety of conditions affecting the reproductive health. Obviously, since we are talking about males, so reproductive health of males only. For example, the presence of abnormal cells in a urine or semen sample may suggest infections, inflammation, or malignancies such as prostate cancer. Elevated PSA, which is a very important biomarker to diagnose prostate hyperplasia or prostate cancer. So the full form for PSA is prostate specific antigen. So its level is actually tested in the blood, and it can also indicate prostate issues including benign prostatic hyperplasia or prostate cancer. Semen analysis may reveal abnormalities in sperm count, motility, or morphology which can affect fertility. Identifying these abnormalities is crucial to diagnose underlying conditions and determine appropriate treatment options. Okay, moving on to the next important subcode that we need to talk about, that is R87, which corresponds to abnormal findings in specimens from female genital organs. So this will provide essential insights into reproductive health and potential medical issues in females. For instance, abnormal results from a pap smear. Pap smear is again something I've previously talked about. I think it's done to test or to look for any source or any evidence of cervical cancer, which is the cancer of the cervix of the uterus, and which is the most common cancer in women. Such as the presence of atypical cells, which can indicate precancerous changes or cervical cancer. Elevated levels of certain hormones in blood tests may signal conditions like PCOS, means polycystic ovarian syndrome, which is again a very common manifestation nowadays, particularly in the teenagers or the adolescent girls, or ovarian dysfunction. Vaginal swabs may reveal infections such as bacterial vaginosis, yeast infections, fungal infections, or STDs, particularly gonorrhea, which require prompt treatment. Analyzing these specimens is crucial to diagnose female reproductive disorders and guiding appropriate management strategies. Okay, next important subcode that we need to talk about is R97, which corresponds to abnormal tumor markers. So these are substances produced by cancer cells or by the body in response to cancer, and their levels can provide valuable information about the presence and progression of tumors. Elevated levels of specific markers such as again PSA, which we already talked about for prostate cancer, or CA125, which is important for ovarian cancer. These can indicate the presence of malignancies and help monitor treatment response, because how it can help in diagnosis, or how it can help in indicating whether the patient is suffering from that particular cancer, that is something I've already discussed. But how it can also monitor treatment progression or treatment response, that is, say for example, I have been detected positive for ovarian cancer, so the level of CA125 is very much elevated, very much high in my blood. And then when I go to the doctor and the doctor gives me medicine, whether it's oral chemotherapy or injectable chemotherapy, whatever it is, I am taking my therapy, I am doing my treatment, and then after, say for example, 2 months or 3 months, when I'm again going to test my test the level of my CA125 in my blood, and if the level actually goes down considerably, goes down, say for example पहले 100 था अभी 50 हो गया है, so it has reduced by 50%, so that means my treatment progression or my treatment response, the response of my body to therapy is very good, isn't it? But say for example वो पहले 100 था अभी 90 हुआ है, या फिर पहले 100 था अभी बस मतलब 100 ही है या 98 हुआ है, that means the treatment response is very bad, my body is not responding to the treatment. So in that case the doctor will try something else. Okay, maybe he was first trying oral chemotherapy, now he is saying that there is no response, so now he will go for injectable chemotherapy, or maybe he will increase the dosage. Okay, so for that reason also these biomarkers are very much important. However, abnormal tumor marker levels are not definitive for cancer, as they can also arise from benign conditions, making it essential to interpret them in conjunction with other diagnostic tests. Changes in tumor marker levels over time can indicate disease progression, recurrence, or response to therapy. Regular monitoring of these markers can aid in the overall management and treatment decisions for patients with cancer. And lastly, we need to talk about R99, which corresponds to ill-defined and unknown cause of mortality. I think what is mortality, I have again discussed before also. Mortality is the death rate. So it refers to deaths that cannot be attributed to a specific disease or condition, often complicating public health statistics and disease tracking. These cases may arise from insufficient medical records, vague symptoms, or overlapping health issues that obscure the primary cause of death. Commonly, such dates are categorized as undetermined or classified under non-specific conditions, leading to challenges in addressing underlying health trends. They may also reflect broader societal issues such as inadequate healthcare access or underreporting of certain diseases. Understanding and improving the classification of these mortality cases is crucial to develop effective health policies and interventions aimed at reducing preventable deaths. So I think that's it. We will be soon moving on to, finally we are done with this particular module or topic, so it's a good news. Congratulations to you also and to me also. So we will be soon moving on to the next important topic or module of medical coding. Till then, please stay tuned and please like, share and subscribe ITLS Academy. Thank you.